Hello class, today's lecture is chapter 2 and chapter 28. Chapter 2 will be on cultural diversity and chapter 28 will be on complementary and alternative therapies. The objectives of chapter 2 is to explain concepts of cultural diversity, describe influences that affect culturally competent healthcare, discuss examples of diversity in health and illness care, including culturally based traditional care, practice cultural competence when assessing and providing nursing care for patients from diverse cultural groups, discuss factors in the healthcare system and in nursing that facilitate or may impede culturally competent nursing care. What is cultural diversity? Cultural diversity is diverse groups in society. Um, they can be racially diverse, ethnic origin can be different, religious affiliation, or languages. Cultural diversity can also affect people as far as their physical size. Different people from different areas may have sizes that are different. There's been times when individuals have even talked about maybe the Asian population a lot of times having, depending on what part, having being smaller. Cultural diversity can be related also to gender. It can be related to sexual orientation, age, and or disability. It also can affect socioeconomic status, occupational status, geographical location, and all these type of things vary from culture to culture. Cultural diversity in the nursing profession. I would like for you guys to basically know that nurses, they interact with diverse populations on a daily basis. So as a nurse, you need to really try to provide culturally competent care, and it basically involves you developing a certain amount of knowledge and skill set as it relates to various cultures. And also it's important because of the fact that you take care of various type of different populations, that nurses must develop sensitivity as well to other cultures. Culture. Culture is basically, the definition of culture is a shared system of beliefs, values, and behavioral expectations. This provides social structure for daily living. It defines the various roles and interactions with others and in families and communities, and it's apparent as far as in the attitudes and institutions unique to that particular culture. A culture does not necessarily mean that you're particularly talking about a race, or even necessarily just um, a ethnic background. A culture could be just the way that a certain institution or somewhere interacts with each other. For instance, nursing, they tend to have their own particular culture. They have their way, their system, their beliefs, their values, how their expectations, or how they behave. So, like for instance, if you look at the institution here, Everest University has their own specific culture, and within that culture, we have nurses who have what they probably would call within Everest a subculture. So within the culture of Everest University and how we interact with each other, what the belief system or the patterns are, nursing within itself has their own defined culture or subculture if you look at it on a greater realm. Okay. Now we have question. Question first of all is tell whether the following statement may be true or false. Culture includes the beliefs, habits, likes and dislikes, and customs and rituals learned from one's family. The answer to that would be true. Okay. I was speaking earlier and I was talking about the subculture. I was telling you guys how Everest University within itself has a culture, and then you have another large group within that culture, which is maybe the nursing department. So, which we would probably, if you would just look at CCI, Corinthians Colleges, and Everest University, you would look at it as the subculture within the nursing department being like the subculture within the bigger culture, which is Everest University. So the definition of a subculture would be a large group of people who are members of a larger cultural group. So that would describe the nursing department. They will have certain ethnic, occupational, which in our case they're occupational or physical characteristics not common to the larger culture. So that's what I'm saying when I'm saying like nursing, we have our own language, we are who we are, and our characteristics and what we bring as being nurses is not the same characteristic as the overall Everest University. So that makes us a subculture within that bigger culture. So you have groups in society. The groups that you have in society are mainly the dominant group, and then you have what they call the minority group. The dominant group is usually the largest group in the society. It doesn't necessarily have to be the largest group, but it can be. It's most of the time the dominant group is generally the larger group. The group has the most authority in cases to control values and pose any type of sanctions in society. Okay, now the minority group, which is generally the smaller group, has a physical or cultural characteristic that identifies the people as different than the dominant group. So I mean, if we were to talk in terms of ethnicity, the dominant group would probably be the Caucasian group, and the minority group would be like the African American group. Um, the dominant group at this school right now, I would think would probably be the medical assistant program, and the minority group, which was probably the smallest group, would probably be, I think it's the respiratory program at this particular time. Now we're going to start talking about, since we identified the various groups that we have in society, primarily the dominant and the minority group, we're going to discuss now various definitions as related to culture. The first one is cultural assimilation. Another word for cultural assimilation is acculturation. This is where the minorities living within a dominant group lose the characteristics that made them different. values replaced by those of the dominant um, culture. So basically, depending on what culture, a lot of times what they're basically saying is that if a person comes and they're living within a different culture than what they're accustomed to, generally what they'll do is they will start taking on characteristics of the culture, which is, you know, a dominant culture in which they are living. So, for instance, let's say that you lived in up north and you had a different type of accent, you had a different type of way of life or whatever. Well, then what, and you moved to the south. Well, generally, after you've been living there for a little while, you may start to what they call assimilate, which means that you'll start to replace different things that you used to do and start taking on characteristics of the people in the South for where you're living. The second definition would be one called cultural shock. This is the feelings a person experiences when placed in a different culture. It may result in psychological discomfort or disturbances. So when I first moved to Florida, I could say that I was in a culture shock because the experiences here were totally different um, from where I was from in the Midwest. So it makes you feel a little uncomfortable. You're in a different situation, and it takes you a while to accustom yourself or start assimilating to that different environment. Okay, question. Which of the following occurs when a minority group living with a dominant group begins to blend in and lose the characteristics that made them distinct? Okay. A. Cultural imposition. B. Cultural conflict. C. Cultural assimilation. D. Cultural shock. The answer, of course, would be C. Cultural shock. The next thing that we're going to talk about is ethnicity. Ethnicity, first of all, I would like to say ethnicity is a sense of identification with a collective cultural group, largely based on the group's common heritage. I do want to distinguish that ethnicity is not the same thing as race. Ethnicity, being, for instance, Spanish may be an ethnicity, but being Latino and that type of thing is more or less, or Hispanic is considered a race. So the fact that a person identifies with a Hispanic or with the Spanish speaking people, or the fact that I may identify, maybe someone identifies with a Jamaican, but they are really still maybe considered a black person or African person, African race. So I just wanted to make sure that I clear up with you that ethnicity is not the same thing as race. Race, not the same as ethnicity. It's typically based on specific physical characteristics, skin pigmentation, body stature, facial features, hair texture. The five major categories are American Indian or Alaska Native, Asian, Black or African American, Native Hawaiian or other Pacific Islander, and white. So those are the five major characteristics, and they're constantly trying to update. As far as like when you think about Latino and Hispanic, that really does go into ethnic. It doesn't go into race. And a lot of times, what you find is people who are Latino or Hispanic may identify with black or Indian or white, depending on what region they were in or how they look as far as their outward physical characteristics. So, once again, race is not the same as ethnicity. It's typically based on specific physical characteristics. Like I said, characteristics like skin pigmentation, body stature, facial features, or hair texture. The five major categories: American Indian, Asian, Black or African American, Native Hawaiian, or other Pacific Islander white. Stereotyping. One assumes that all members of a culture or ethnic group act alike, may be positive or negative. Negative may include some form of racism, ageism, and/or sexism, often performed by the dominant group about the minority group. So basically, what they're saying is that stereotyping may be positive, may be negative, and this is just when you try to say that all people in a particular group have a certain characteristic. A lot of different people have been guilty of doing that. And it may be a lot of times based on individuals' own experiences that they have had. So they may lump people in together. I don't have to give you any type of examples of people stereotyping, but like they may do it negatively and they may do it positively, you know. And I know some people say, well, positively, what could be positive about a stereotype? I will give you one example. Like a lot of times you hear people say stuff like Asian people are smart. So that's a positive stereotype, but that doesn't necessarily mean that that is true or correct. Question. Tell whether the following statement is true or false. Stereotyping occurs when people ignore differences in the cultures in which they live and proceed as if they do not exist. That would be false. Stereotype is not ignoring differences. Stereotype is assuming that all members of a culture or ethnic group act alike. I will explain to you later on exactly when you ignore the differences of other cultures and exactly what that is, that termination is, and it's basically cultural blindness is what they're describing. So all of us need to identify prejudices, and first step is by eliminating them. And that will come from people just basically looking within. We're going to continue on with cultural terminology. One is cultural imposition. And basically, that's just saying that everyone should conform to the majority belief system. So if everybody is Catholic, you feel that everybody should be Catholic and believe the things that you believe. If you're a Republican, you feel that everyone should think or act like a Republican. Cultural blindness ignores differences and proceeds as if they did not exist. A perfect example of a cultural blindness would be, for instance, you see someone, you're working as a nurse and you come in and you see someone, and this individual is of a different type of background. Maybe that person looks like they may be Islamic or something like that. And you have a menu and you don't acknowledge whether or not that person may need something different in their menu. Instead, you just go ahead on and serve whatever is on the menu and assume that that person will eat or what you have on the menu. Cultural conflict. People become aware of differences and feel threatened. Response. Ridiculing beliefs and traditions of others to make themselves feel more secure. So basically, all you're doing is that you're just talking about um, what's going on with other people and having culture. Uh, uh, oh, all whatever people do this, all Republicans do this, all Democrats do this. And the reason why you're doing that is so that you feel like what I'm doing or what I'm saying is uh, more secure. Ethnocentrism. Ethnocentrism is a belief that one's ideas, beliefs, and practices are the best or superior or more preferred to those of others. On your short term mission trip to my country of ministry, I would advise the men to dress in slacks and collared shirts, women in long skirts and modest tops, remove body piercings, jewelry, and keep all tattoos covered in public. Any questions? And then the person says, hasn't this country ever heard of personal freedom? That's the cartoon on the PowerPoint. So what I would do is to make sure that I notice the difference between the culture conflict and the ethnocentrism because there's a distinct difference between the two. One is dealing with a person feeling threatened and talking about people to like minimizing their characteristics or talking low so that they can feel more secure. Then the other one is just believing simply that, hey, I'm the best, my beliefs are or and my practices are the best or superior. Okay. question Question: which of the following describes the concepts that occurs when a nurse believes that her own ideas, beliefs, and practices are the best or superior to those of her colleagues and patients? Is that cultural diversity? Is that B, cultural shock? Is that C, stereotyping? And is that D, ethnocentrism? Well, we just got finished talking about it. It's D, ethnocentrism. So, as nurses, we all would want to practice culturally competent care. And by knowing this, these are certain things that we have to uh, take into consideration. We have to take in physiologic characteristics. We have to take in psychological characteristics. So the biological variations of the manner in which behaviors are interpreted, and what they mean by physiological characteristics is this based on ethnic or gender or whatever, or there's going to be variations in how people look or how they may treat themselves, their body, as far as how their behaviors are being interpreted, which are the psychological characteristics. You may find that some people may be a little bit more stoic. You may find that some may be a little bit more emotional. Mental health. Um, the individual perception of a person's mental health may surely be based on the client's culture. Gender roles. There may be some cultures where they may say that males may be the dominant member of the family, or you know may take the role of being the person in charge. Language and communication, exchanges of messages and the creation of the meaning. People may say things in a different way. They may communicate a different way. Some people have various what we would call slang messages or something. Okay, so based on that, you have to notice what the differences are and take that into consideration. And that is all part of you giving culturally competent care. You need to orient to the space and the time. And basically, what they mean by that is that there are rules regarding personal space and time that vary greatly among cultures. So what you need to do is you need to know that you can't just walk up on someone just because you see that person, because they may feel uncomfortable. They may not be touchy feely. They may feel that 15 minutes early is late. Food and nutrition, we talked about that. We talked about um, the a person that just ignores, someone else and doesn't take into consideration what is going on with them as far as their food and their preparation of their food. Family support. There may be family dynamics, within the culture of their family that you may have to take into consideration, and socioeconomic factors. There may be a culture of poverty and lack of basic needs within a certain family structure. There are reactions to pain, and a lot of times that's very important for people to know, that based on a culture, uh, you need to recognize that each person holds various beliefs about pain. You need to respect the patient's right to respond to pain in whatever his own fashion may be. You may feel that that individual is just really, really emotional, or a person may also be feeling or experiencing a lot of pain and be very stoic. So, as a nurse, you need, when you're doing your assessment and you're taking care of this particular patient, it's very important that you take all of that into consideration when you're taking care of the patient. And never ever stereotype a patient's responses to pain, though, based on their culture. The culture of poverty. Um, just know that poverty within itself is a culture, and what that does is that leaves feelings of despair, that has an impact on whatever the day-to-day attitude that that person may have toward life. Unemployment and a need for finances or government aid, or unstable family structure may result in decline in personal self-respect and a retreat from particularly some type of community involvement. Question number one: tell whether the following statement is true or false. The healthcare system is a culture of its own, with nursing being its largest subculture. Okay, the answer is A, which is true. Remember when I was speaking with you earlier, I discussed the healthcare system. I even put it into, I spoke about Everest University and saying that the nursing department within itself has its own culture. So we're what we consider a subculture of a larger culture, which is Everest University. So the answer to that one would be true. Cultural influences in illness care. Culture and ethnicity directly influences thoughts and feelings about people's values and or beliefs on health, illness, and care for an illness. Um, Basically, traditional therapies vary among cultures and ethnicities. It's important for nursing to gain knowledge of therapies used and incorporate it into care if at all possible. So basically, what we're talking about is, for instance, there was an example. A lot of times, I would put the YouTube video in my video presentation, and I'm gonna look and see if I still have that. But what it was it was basically a reaction that a nurse had to a Asian person that used the procedure of cupping, and it's our responsibility as nurses to probably just educate that person about signs and symptoms of infection instead of freaking out. You need to know that this individual, that's just part of their culture. Care must be sensitive to needs of individuals, families, or groups from diverse cultures. The healthcare system is a culture. Oh, we already talked about that. Sorry. Okay. We talked about factors that affect culturally diverse interactions. We talked about cultural background of each participant, expectations and beliefs of each person about healthcare, and cultural context of the encounter. We need to speak about the degree of agreement between the sets of beliefs and values of the two persons. Guidelines for providing culturally competent nursing care. Basically, as a nurse, you need to develop cultural self awareness, develop cultural knowledge. Of course, we talked about accommodating cultural practices in healthcare. You need to respect culturally based family roles, avoid mandating change, and seek cultural assistance. Okay, enclosed is the preview of the competent versus incompetent cultural healthcare video. If you can view it, if not, you can also as well just view it from the regular PowerPoint presentation that is on your that is on the Blackboard site. Chapter 28, Complementary and Alternative Therapies. The objective of this chapter is to differentiate between complementary and alternative medicine from allopathic medicine. Also to compare and contrast the beliefs about the origins of diseases and ways to promote health of each of the five main categories of CAM and CAT. We're going to describe ways in which nurses can use knowledge of complementary and alternative modalities in providing patient care, and we're going to identify the knowledge the public should possess about CAT if they wish to be informed consumers. And lastly, describe ways in which nurses can use selected complementary and alternative modalities for self care and health promotion. Um, First thing that we're going to talk about is allopathic medicine. Allopathic medicine was dominant for about 100 years. It's known as biomedicine, or what one would call traditional medical care. It was spearheaded remarkable advances in what they call biotechnology and surgical interventions. What they use is pharmaceutical approaches and also diagnostic tools. So, in Within allopathic medicine, you have the biotechnology, surgical, pharmaceutical, and diagnostic tools. The belief is that illness occurs in either the mind or body, and that they are what one would call separate entities. Make sure that you remember that there are specific definitions for the different types of treatment modalities and to know about the beliefs. So, as we can tell, with allopathic medicine, we believe that illness occurs in either the mind or the body, and that they're both what they call separate entities. Um, the definition of allopathic medicine is health is the absence of disease. Illness is an event caused by an external agent, and curing is accomplished by external agents. Curing occurs more quickly if we destroy the invading organism or repair the affected part. So this is how you can see where they tend to use treatment modalities such as surgery and or pharmaceutical agents. CAT, CATS, which is complementary alternative therapies, um, is therapies that can be used in addition to allopathic medicine. Just like they said, it's complementary, so it's in addition to. Also, what I want you to do is make sure that you note the spelling. It's not complimentary like you compliment someone, like say something like, oh, you're attractive. That's spelled with a IMENTARY. This type of complimentary is one that is in addition to, and it's spelled with a EMENTARY. So make sure that you know that distinction. Alternative therapy is therapies that are used as opposed to, okay, alternative therapies are therapies that are used as opposed to allopathic medicine. So instead of using the traditional type of medicine like the surgeries and the prescription, the pharmaceutical agents, um, and that type of thing, you'll be using some type of alternative therapy, and that's what's going to be the topic of your basic presentation. Complementary alternative medicine is mind, body, and spirit are integrated and contribute to health and illness. Health is a state that's characterized by a dynamic balance of mind, body, and spirit. Illness is a manifestation of what they consider an imbalance or a disharmony. Healing is done by the patient, and healing is a natural, slow process involving the mind, body, and spirit. So it seems like the difference, like, remember with allopathic medicine, they were saying that with allopathic medicine, that the mind and the body and the spirit and that type of thing are all separate. With complementary alternative medicine, they were saying that the mind, body, and spirit are integrated. Okay, so there are various types of cat therapy: acupuncture, you have alternative modalities, aromatherapy, aura, chiropractic medicine. So these are therapies that they use in addition to the allopathic medicine. Question: tell whether the following statement is true or false. Allopathic medical care has been very effective in dealing with chronic illnesses. The answer is true. Terminology: integrative care is a combination of allopathic and complementary and alternative modalities. If you read in your book, it goes into detail more about how it came out to be, and when they talk about the difference between Western allopathic medicine and your complementary and your traditional medicine, and so and how they integrate all of that together. Holism. Holism is connection and interactions between parts of the whole. Continuous interaction and change means the body is not the sum of its parts. The general adaptation syndrome or gas is basically the immune response that occurs throughout the body, and it's developed by this theory, or this thought process is developed by Hans Selye. Holistic nursing uses the holistic principles of CAT, which includes mind, body, emotions, and spirit. Nursing knowledge and CAT, increased use of CAT. Continued therapy can be used from the home. Also, a person using CAT, there's a lot of ethnic, cultural, and health practices that may be retained as far as them using CAT. There's expansion of clinical practice as defined by half of the state boards of nursing, and you need to also be able to realize and make sure that when you practice in CAT that you're not practicing outside of your scope. Um, Also, you need to be able to evaluate potential harm. Uses of CAT. There are a lot of different uses of CAT for chronic illnesses, stress management, and reduction of pain, or promote healing and manage symptoms. And as you can see, there's a cartoon there. The key to stress management is knowing how to vent your frustration. And you see right here, the lady has the vent. Okay, we're going to go into briefly. I'm just going to mention various types of cats by names, and I want to let you know that although I'm going to mention these, and you can briefly go over these, and these methods of cat will assist you too, probably with your presentations. It's also okay if you decide, um when it comes time for you to have your test, I will mention specific types of cats. I won't expect for you to know all these various different types of cats, because there are like tons and tons of cats. Okay, one of the first ones is Ayurveda, which originated in the Vedic civilization of India, and it's a balance among people, environment, and large cosmos. And it says that's an integral to health. It talks about the doshas, and the doshas are the body's metabolic types. Um, and the central is the patient's basic constitution. It uses nutrition, exercise, herbs, breathing, medication, massage, aromatherapy, and purification. So, um, the three doshas in Ayurvedic medicine is the Vata, which means it's changeable, the Pitta, which means it's intense, and the Kapha, which means it's relaxed. Also, the next type of therapy is yoga. Yoga was practiced in India for like thousands of years. It includes ethical models for behavior and mental and physical exercises. It is basically aimed at the production of spiritual enlightenment. It promotes strength and flexibility. It increases endurance, and it does promote relaxation. um, Types of yoga. They have all types of yoga, and you can research more, um, like Ashtanga, and it goes on and on. And they got the only type of nursing considerations that you need, it might be need to give to clients might be about knowing what that person's physical condition is, because yoga itself can get pretty intense. So you have to really encourage types of yoga that are compatible with the client's physical condition. Traditional Chinese medicine. Traditional Chinese medicine is a healing system that is thousands of years old. Believes that the interaction of people with environment creates health. Practitioners obtain a health history and observe specific parts of the body. Central concept is Qi, or Kai, Yin, and Yang. It uses acupuncture, diet, herbs, massage, and energy exercises. Characteristics of yin and yang. Yin is cool, moist, and dark, and yang is hot, dry, and light. Acupuncture. Acupuncture. Um, Basically, they're saying that Qi flows through body through 72 vertical body meridians, um, and they place thin needles at a particular acupoint to change the flow of energy. It supposedly reduces pain, promotes adherence to substance abuse programs, it minimizes nausea and vomiting, um, and the only nursing consideration that you would tell a person is that they basically might need 1 hour of interrupted time in bed after receiving acupuncture. And here's a picture of all the different acupuncture meridians. And a person that is really trained in acupuncture knows what all those different meridians and points mean in a person's body. The second type of cat will be Qigong, and it's a system of posture. And what it does is it enhances systemic health. It's a gentle and dynamic form of exercise and breathing techniques, and types of visualizations, which helps them, relax, and uh, helps, apparently supposed to help their systemic health. Spiritual approaches to what one calls shamanism. It is the most widely practiced medical system. Illness is thought to originate in the spirit world. The shaman, or the medicine man slash woman, accesses the spirit world to obtain information on the proper treatment. And when a person practices shamanism, the treatment may consist of retrieving lost soul energy, restoring the individual to right relationship with the spirit world, and whatever the treating symptoms may be. Shamanism healing techniques vary. They may use healing techniques such as they might involve native plants and herbs and animals and rituals, ceremonies, and purification techniques. The nursing consideration is that they may develop patience and tolerance, basically, for the various types of shamanism. Spiritual approaches also can be used from the Native American tradition. Healing takes time, and they say that time contributes to healing, which is pretty much true. The distractions sometimes of modern life may often interfere with potential healing agents. Modern culture encourages us to maintain a low level of emotional awareness, and ceremony is important to receive guidance and assistance from the spiritual dimension. Um, Next would be homeopathy. Homeopathy, a lot of you guys probably do this and don't even realize it. It supports the body while symptoms run their course. It's based on the law of similars and law of infinitisms. It looks for individual patterns. Its treatment consists of matching patterns with remedies. Um, uh, the only nursing consideration is that homeopathic remedies can be counteracted. Naturopathy. The next one, naturopathy, began in the early 1900s in the United States, and it's a system of medicine and it's a way of life. It belief in the vitalist doctrine. Health is a dynamic state of being, and providing energy to deal with life. And illness can be attributed to ignoring natural laws. So basically, what they're saying is that if you don't do the natural things that you're supposed to do to your body to keep you healthy, they attribute that to illness. Therapy support the self-healing mechanism of the body. Okay, chiropractic. It investigates the relationship between structure, spine, and function nerves of the human body. Functions of the body are controlled by the nervous system, and problems sometimes caused by subluxation, by adjusting the spine, the nerve pressure and stuff like that is released. Um, People who have been to chiropractors says that generally that it pretty much works. The question: tell whether the following statement is true or false. According to the NCCAM, when prayer is included in the definition of CAT, the domain of the mind and body medicine is the most commonly used domain. And that would be true. Mind and body modalities. Relaxation. Relaxation promotes parasympathetic activity while decreasing sympathetic activity, which is that fight or flight. Um, Meditation, the change of physiology to a more relaxed state, and it alters perception to an increased level of acceptance. Guided imagery, the use of five senses to imagine a process occurring as planned. Benefits of relaxation for patients. Of course, relaxation reduces anxiety, it reduces stress, it reduces muscle tension and pain. It also improves function of the immune system, enhances sleep and rest, and it improves sense of well-being. There are a lot of countries where they almost make people take a relaxation break or nap or siesta during the day, and they say that promotes them to be more productive during the workday when they come back. Energy medicine modalities. Life force feeds and nourishes an organism that is carried by interacting structures. We already talked about basically the chakra, which was concentrated areas of energy in the spine, and the aura, which consists of at least 7 layers of energy surrounding the body. And here is the location of the 7 major chakras. The energy healing approaches, they have two main focuses, which are therapeutic touch, which is the use of hands on or near the body with intent to heal, and the healing touch with use of a collection of energy techniques to assess and treat the human energy system. Question: tell whether the following statement is true. Healing touch can be used to stimulate wound healing, so they say that that is true. 4 scientific premises of therapeutic touch is a human being is an open energy system. Anatomically, a human being is bilaterally symmetrical. Illness is an imbalance in an individual's energy field, and human beings have a natural ability to transform and transcend their conditions of living. Other healing modalities, of course, that people can use would be humor therapy. Um, they say that laughing and humor produces an increased immune response, and also aromatherapy, where they say that pleasant smells can evoke stored emotional memories from the brain and change a person's perceptions and behavior. Um, then there are different types of aromas that people use, like for instance, peppermint for nausea, and lavender for insomnia and whatnot. But you have to be like very careful when you use those type of healing modalities because of the fact that um, some aromas may make people feel worse. Other healing modalities, sound healing. There are specific sound waves, vibrations at certain frequencies are usually harmonious with the body. Nutritional therapy. Um, there are holistic approaches and to certain food choices that could be used, and of course, there's always intercessory prayer, which means that you're praying on the behalf of someone else for healing. Other healing modalities, botanicals and nutritional supplements, like certain herbs that people use that they say cure certain things. Nutritional supplements or chemical compounds also that contain ingredients that may be thought to promote certain amounts of health. Question. Um, and which one of the following CAM systems is the central theme? Understanding the patient's basic constitution or dosha. A. Ayurveda. B. Qigong. C. Traditional Chinese. And D. Uh, I'm sorry, yoga. The answer will be B. Qigong. Question. Tell whether the following statement is true or false. Since holism is a philosophy and not a specific nursing role, holistic nurses can be found in all varieties of healthcare settings as well as in independent practice settings. The answer is A, true. That is the end of the lecture. If you have any questions, feel free to come and see me. Thanks. Have a nice evening.